Maybe we can go ahead actually and start with some intros, since Andreas was the last anyways that we were going to throw to. So I'll go ahead and introduce John Fries, and he'll talk to you about Miiskin and what they're up to. And then Justin, if Andreas gets on, you can throw to him.
Great.
Thank you. Should I continue?
Yeah, let's get started, everyone.
Thank you very much. I'm John Fries. I'm the CEO and founder of Miiskin. Miiskin is an app and a platform that helps people identify changes in their skin with images, such as an existing mole changing or a new mole appearing on the skin. So we are on a broad mission to end skin cancer mortality by 2040. And I can give you a little bit of perspective. More than approximately 9,000 people are diagnosed with skin cancer every single day in the US. And all the cancer organizations recommend people to take more control over their skin health. And this is exactly what our app and our technology do for them. We have over 500,000 downloads on a global scale, and approximately 100,000 of them is in the US. We have more than 120 hospitals and dermatologists all over the world that recommend Miiskin app to their patients. And one of the key important differentiators for us is that we have partnered with 5 of the world's top skin cancer organizations, including being the only app technology that has partnered with the Skin Cancer Foundation. One of the main reasons that these skin cancer organizations have chosen to work with us is due to our unique approach and how we use technology. We do not claim to detect or assess skin cancer, but using emerging smart technologies to assist the user with identifying changes in the skin. Since a change in the skin can be a very early warning sign of skin cancer and need professional attention. So this is so much more than just taking photos of your skin. Let me briefly showcase to you what we're helping the users with. I'll share my screen now. So this is a technology that we call skin mapping, where the user can use skin mapping. And what we do, we use machine learning, artificial intelligence, and computer vision to identify lesions, skin marks that you have on your body. And over time, you will be able to identify anything new on your skin. It is a tedious process to look at your skin for new things, but it's extremely important. And we have made a consumer technology that does this a lot more easier. More than or approximately 80% of all new melanoma cases form as a new mark on your skin and does not come from an existing mole changing. So looking out for new moles is extremely important to the user. Today, I'm really excited to showcase this, which is our newest invention, our newest technology. And this is what we're going to talk about is automatic skin imaging, which is a technology that gives the user to actually, in an autonomous process, take images of their skin. I'll just showcase this to you as a talk. So basically, you're simply just placing the phone on the table, and the technology in our app detects the user and identifies the user and his behavior, and you are guided through this process with a Siri voice. You can do this in full privacy on your own in an autonomous process without the help of anybody else. And this technology is developed using the latest technologies from Apple, augmented reality, computer vision, and machine learning to capture these moments and taking the images. And doing this and creating a smart technology is very simple for the user to use. I'll jump back. Sorry. So I'm really thrilled and excited to be here today and talking about the future of AI and machine learning in health. But I'm also really showing the promise of that people are already using these technologies to use and emphasize on the use of smart technologies in order to make people create some awareness about their skin so they can find their skin concerns in time and go to the doctor and see them. Thank you very much. Over to you, Justin.
Awesome. Great. Thanks, John. That was really cool. I really like that. Was the first time seeing the full demo video. That was awesome. As John said, I'm Justin. I'm the CEO and co-founder of KinoTek. At KinoTek, we have a mission to bring the power of movement analysis to the mainstream with the use of artificial intelligence and computer vision. Currently, we work with movement clinicians. Movement clinicians are physical therapists, occupational therapists, chiropractors, athletic trainers, etc. Basically, any licensed medical professional who uses movement analysis as a way to treatment. These clinicians share common problems of highly subjective data, lack of time, and to overall achieve patient buy-in to their rehab programs. These problems result in 70% of patients not completing their treatment, 1 in 7 patients lost because of lack of insurance reimbursement, and at least 50% of their time is spent educating their patients to achieve patient buy-in. This is where our software comes in. By harnessing the power of AI and computer vision, we are able to accurately assess movement in real time. Our interface uses 3D visualizations to communicate complex data to clinicians and patients. We can communicate KPIs to justify care. We can do an injury risk assessment and various other features that fully immerse patients in their prescribed programming, resulting in instant client buy-in. So let me screen share real quick, show you the video. So you just see here. So this is it being used in a clinical setting. So we can track dynamic movement, running, real-time measurements, ground floor. We use computer vision, so there's a computer set up right in front of her that you can't see. This is what it looks like on the laptop from the user perspective. The UI, where it picks up risk, shows different KPIs, and this is the injury risk assessment, where we use our AI and computer vision to assess their movement, show different features to help with diagnosis, enhance client communication, and yeah, so I'll stop sharing that. All right, and so movement clinicians can run through assessments now that previously took 60 minutes and 5 minutes or less with our software. A huge shift in the industry, allowing clinicians to spend more time on treatment rather than assessment. We can provide objective data that can be used to justify care and begin decreasing the prevalence of lost insurance reimbursements, currently unavailable. Prior to our software, clinicians in the sports world would spend 3 or more days looking at subjective data to assess an athlete's injury risk. What used to take 3 days for someone with 15 plus years of movement analysis experience, we can do in a matter of 10 seconds. This is a monumental shift in the movement analysis industry and something we're very proud of. We're still a young company and are truly just getting started. Due to the pandemic, we have an amazing opportunity in medical space. We are planning to be the first company that can provide remote movement assessments, changing the way clinicians approach telehealth around the world. Leveraging our partnerships with Microsoft and leading universities, we are on the trajectory to be the industry leader in a very underserved market with currently no market leader. I'm very proud of my team and honored to be able to speak with you all today. I appreciate your time and look forward to answering any questions you may have. I will send it over to Andreas, who I think just joined. Thank you.
He did. Hi, Andreas.
Awesome.
Excellent. Good morning, everybody. My name is Andreas Forsland. I'm the CEO and founder of Cognixion. We're actually a neurotechnology company that's focused on accessibility. So what we're doing is essentially targeting about 500 million people worldwide that have communication disabilities. Those 500 million are comprised of a range of individuals from birth to seniors, so individuals with congenital disorders, including autism, up to progressive disorders such as, say ALS or MS, and then acquired disorders such as traumatic brain injuries and strokes. So if you look at the cumulative number of individuals in our community that are affected by a disability, either cognitive or physical, oftentimes those disabilities present themselves with a difficulty in communicating or being understood. So what Cognixion is focused on right now is applying AI, machine learning, augmented reality on mobile and AR applications that individuals with disabilities, their caregivers, and speech therapists can download and use for therapeutic purposes as well as access purposes for generating speech using predictive keyboards within an AR environment or within a mobile environment, as well as using things such as eye tracking access. So we recently launched a product called Speak Pros into the Apple App Store. It's available for free to download for any individual, family member, or even a clinician to download an evaluation copy. It includes a number of communication methods, including sentence building, stored phrases, and an academy that allows them to learn how to rehabilitate and communicate with others. So it's a chatbot that's integrated inside of Speak Pros. Within the application for individuals that have compatible devices, we also provide an in-app upgrade. So there's additional features and functionality, including several predictive keyboards that are accessible that people can access depending on their motor limitations. And then we have an additional upgrade within the application that you can, with a 30-day free trial, you're able to try out facial recognition and eye tracking as a means for controlling the cursor that you can select objects within the mobile environment. So essentially by moving your face or adjusting your eye positions, you can move the cursor, and by blinking, smiling, or just dwelling on the object, you're able to make those selections. So the situation today is that eye tracking isn't a new technology, but the way we're going about doing eye tracking is very new in the sense that we're using augmented reality on mobile devices using embedded infrared cameras. So there's no need for additional hardware as it used to be. So historically, eye tracking solutions for communications ranges between $10,000 and $16,000. And now we can actually bring that cost down tremendously for the individual, whether they're paying out of pocket or through a copay through insurance, and also reducing the burden on healthcare, the industry as a whole, by reducing the cost and the complexity for dealing with insurance reimbursement. Lastly, our products are available for purchase and use direct for individuals that have the disposable income to be able to say sign up for an in-app subscription. If you need insurance support, we can also provide that support through a turnkey solution that's fundable through Medicare, Medicaid, and private insurance across 48 states, as well as anywhere there's an armed forces location worldwide. So that's a little bit of an overview about Cognixion and what we're doing.
Awesome. Thank you, guys. So let's dig right into the technology. Let's start there. John, this first question is for you. How essential is ease of use for both consumers and healthcare professionals when it comes to the adoption of AI and the various technologies? You know, what have you learned about the experience that they're looking for with this technology?
I think it's really important when it comes to consumer technology. Simplicity, ease of use, convenience is a must, or else people won't use it. You have such a small time with convince anybody to use a product. So looking after your skin self-examination has been recommended by the healthcare industry for years now. And most doctors know that this is a lot easier said than done. We've used machine learning AI to simplify this important practice so the users are assisted in a fast and convenient way. By doing so, we're broadly embraced by the clinical community because we help people and patients at home. And that's also on that behalf, we're the only skin cancer technology that's been recommended by more than 120 hospitals worldwide. Patient experience and satisfaction with smart technology is extremely important. So if you want to change the world, then you need to change the consumer's behavior and the patient's behavior. Then you get the love of the clinicians.
Okay, great. Justin, discuss how machine learning is powering insights on movement specifically. What is the technology capable of now?
Yeah, so, movement analysis has been something that's been around for, some years now, but with like emerging kind of ideas such as machine learning, artificial intelligence, a lot of the data that you'd be gathering over time that's spending, days looking at spreadsheets, and, that can now be all interpreted and computed and aggregated in real time. And, with us, we can pull it out visually, which provides that extra user interface that people really love, or a lot of our competitors will be able to have one, aggregate all that data over time and then output some really quick information. They're like key indicators, but that idea is really the forefront. That's kind of where we're at now, is taking all of this data, showing it really fast over time, and then computing it and providing actionable insights. And as that grows, in hardware, it's really going to be hardware contingent. You'll be able to see this more on a consumer basis, and that's where we're headed and where the market's headed.
Cool. And now, Andreas, let's talk about the technology in your space. So millions of people have limited speech, due to autism, stroke, or other issues. Which applications have the most impact currently, and which are you most excited about for the future? Because obviously that's a wide range of conditions.
Yeah, absolutely. I think the industry that we operate in is called, it's called AAC, Alternative Augmentative Communication. And so if you think about that and the range of individuals currently that need assistive or alternative communication methods, there are about 150,000 clinically certified speech pathologists in the United States. Of that, we're talking about millions of individuals within the United States that need care and support. Of those millions, most of the attention is spent through education and children. So there's a lot of work and effort going towards adolescent and language development. So where things are today is there's, I think, an overinvestment in underlying language systems and core systems. However, the largest part of the percentage of individuals are adults with disabilities. So there's a lot more adults with disabilities than there are children. And so I think the future is really providing much more AI-powered solutions for what you'd consider generally literate adults that might have motor disabilities, is really, I think, where we're focused and where we think that there's an exciting opportunity to make a difference. Also because that enables people to re-engage with society, increase their independence and being able to go out into the public, and engaging with potential work activities and going back to work. So as a percentage of the overall population, strokes takes the lion's share of disabilities that affect communication. So if you think about individuals with strokes, that's probably the greatest opportunity. Now, if you project forward out, which is what we're really, really excited about, is the emergence of things like AI assistants, and how we can integrate those AI assistants into the communication paradigm. So we're making our software available to, say, people that are veterans through the Veterans Affairs, or adults through rehabilitation clinics, as a speech assistant tool. But thinking about going beyond just communication into environmental controls, where you can now use communication interface to control your smart home, check in on people, send text messages, engage, learn, and grow. The integration of AI assistance within a communication paradigm is really, really exciting.
Very cool. Okay. John, you guys have been very innovative in identifying new features to continue to add to make self-exams more easier for the consumer. So you have ASI, which you showed a little bit about, that's launching this week. How have you identified these features that are really helping those that are being vigilant about, looking for concerns on the skin?
Yes, this is like a two-sided process. Basically, we need to look into and combine the scientific facts and the medical research with consumer behavior and knowledge. So let me give you an example. For example, research tells us that almost 80% of melanoma develop as new marks on your skin. And we also know that more than 50% of all melanoma cases, which is the most deadly form of skin cancer, is found by the patient or the relative. This means that we need to focus on making it extremely simple to look after new moles and marks into hard to see areas, such as your back. So by then analyzing user behavior, we found out that the largest barrier was to take the images in a private setting on your own. And from this knowledge, we developed the automatic skin imaging that combined these unique technologies of machine learning, computer vision, augmented reality into a simple smart feature that the user can use as a one-off in the living room at home by the smartphone. So this is how I see tech when it's best, solving complex challenges with advanced technology into a simple user-friendly feature. That's basically it.
Excellent. Andreas, back to you. So you guys are working on further developments related to AI and AR. You started to tease that a little bit in the end there of your last answer, but is there anything more that you want to draw attention to or tease there?
Yeah, well, I have to echo John's sentiment around simpler is better. I think in the world where things are more and more complicated, because we're working with individuals with disabilities, it forces us to really focus on the essentials and thinking about how can you make things easier, more natural, and making technology adapt to the human as opposed to the human having to adapt to the technology. And because we're kind of moving into a world with our own technology where we're almost kind of quasi-prosthetic in the sense that we're augmenting a human's capability. We've even had individuals contact us and tell us that our keyboards are like a part of their body. Because that is their voice. So it's a whole new level of seriousness around the simplicity that you're trying to design. Regarding the teasing out, we are in fact working on an AI assistant integration. So I'm pretty excited about doing more than just controls, more than just communication, but getting into a very elegant, simplistic integration with environmental controls. And so that's some things that are going to be coming up here in the summer. But the last thing around this, which I think is very important, is this idea of context awareness. So all of us could probably use more insight around what's going on around us, but especially so for individuals that maybe have diminished access abilities. So our focus is investing our time and resources into understanding what's important for individuals with disabilities. And then how can we add context awareness around them so that, say, the systems can adapt and learn more about where they are or what they're trying to accomplish so that we can take steps out of the process to make it easier for them. So I think this movement towards context awareness, whether you're doing augmentative communication like we are at Cognixion, or if you're doing other applications, understanding the user and letting the technology sort of disappear is really, I think, where things are starting to go.
Fantastic. And then Justin, let's talk about opportunities you guys have identified to extend the reach of your platform to new audiences. I know that you have developed features, and you noted in your intro that you're moving into meeting the needs of the PT world.
Yeah, so we were really focusing on the sports world. We didn't see, this is pre-COVID, we didn't really see an opportunity in the medical field for some time. We were anticipating another year. And then with COVID hit, this idea, telehealth kind of shot up, and that's something that we saw in the future, but we didn't think it was going to happen so fast. And when it did, we had an amazing opportunity to be right on the forefront of that. So, in the sports world too, and everything going on, there's so much uncertainty right now with sports leagues. Timing wise, it made a lot of sense for us to make a move, really focus all of our efforts towards this amazing opportunity we have in the medical sector, and leverage our computer vision, augmented reality, all this stuff that we want to do with telemedicine, and now we can do it. So we're really excited about it, and it's been a crazy couple months, to say the least.
Yeah, for sure. All right, so I want to move our discussion into creating community, establishing key partners. I know that the a lot of the attendees are interested in hearing about bridging that gap over to patients and consumers and the bodies that they listen to. So John, let's start with you. You noted that you've received a significant amount of buy-in from the medical community around the world. So what is that process? What has that been like to get to these groups, to get the support of emerging technology? And what are your thoughts for digital health startups, you know, looking to achieve that level of success?
Yeah, you should pay attention, I would say, approach this industry and of course the kind of clinical challenge with caution. That is extremely important. And listening and accepting the industry playground, so to speak, you are in, and play by the rules that the industry complied to. I can mention an example. Like 18 years ago, we saw the first self-driving cars made by Google driving through the streets of San Francisco. Today, we still don't really see self-driving cars in abundance everywhere we go. But we do see a lot of cars having smart technology assisting and supporting the driver for a more safe driving experience. And I kind of like that way of thinking. So consider a similar approach in healthcare, and you get a lot of support that use AI, machine learning, computer vision to support and assist both patients and doctors with monitoring, tracking, timely reporting, before venturing into the more complex elements of assessing, diagnosing. With this slightly more de-risked and transparent approach, we have received enormous amount of support and positivity from the medical community. And they don't have a challenge using machine learning, computer vision to help the patients. At the end of the day, this saves lives. They know it. And we at the same time can see, we see very few negative healthcare professionals. But you have to show that you understand and respect the rules and regulations, because the rules and regulations also saves lives in this industry. So I think that was very short. Understand the industry you're trying to disrupt, I would say.
Yeah, okay. Justin, you initially gained traction in sports medicine like we discussed. You know, can you speak at large about how the use of AI in sports performance and analytics is used today? You know, how easy was that adoption? And you are a Microsoft partner, so I'm curious how that level of support has made a difference for you.
Yeah, so in the sports world, you know, movement analysis has been something that got integrated really heavily about 10 years ago, you know, because the athletes are the most valuable assets, so they, you know, they obviously don't want anything to happen to them. So, you know, now where it's headed, you know, you see a lot of actionable insights, and soon, I think even, you know, one of the questions you asked earlier with machine learning that I forgot to mention is really this idea of predictive analysis and seeing and making predictions on injury. And that's what we, you know, that's what we started with and where we saw a lot of the value there, and we still do, but timing wise, it you know, it's just not ideal for us right now. And in the medical field, there's so many issues, and so it's so underserved, and movement analysis isn't something that, you know, most PT clinics or chiropractors will have. It's extremely expensive for them, and now with computer vision AI, you know, we can start doing and making a change in an industry that hasn't ever seen this and really needs it. And in regards to Microsoft, and so that having their backing and one by being, you know, fresh out of college doing this, young kid, like that level of credibility is huge, you know, for investors or even shareholders and just, you know, selling it, but also to understand the industry and getting insights of something that, you know, I never really had my feet in the water and prior to this. So, and they, you know, they're looking, I never realized how many, you know, the big corporations are all looking into a lot of similar stuff, and they're all competing with each other, and, you know, having that knowledge and seeing where other, you know, like the Apples and seeing where they're headed and using Microsoft as leverage, you know, it's really powerful, and you can really kind of see, you know, the digital health industry in a totally different way, and it helps you accelerate a lot of your decision making.
Very cool. Andreas, you have offerings in both, you know, B2B clinical side and B2C. How has the traction differed in each? You know, what is the understanding of the power of your technology within each of those groups?
Yes, so we kind of look at it as a continuum. and that's kind of an evolved. We sort of pivoted into this idea of this relationship between B2C and B2C, B as kind of B2C to B. It's kind of the merging of the two. And originally, when we launched Speak Pros initially, we were trying to disrupt some of the incumbent players in the market that were heavily reliant on insurance to cover the cost of their extremely expensive systems by providing a software as a service model. So that direct-to-consumer software in-app upgrade model. And what we realized was that worked to get a lot of people onto our platform. So we have tens of thousands of people on our platform using Speak Pros. However, what we learned is that when it comes to someone's voice, it's a psychological barrier that they don't want to have their voice tied up into a subscription. They'd rather have a perpetual license, or they'd rather have a turnkey solution. So what we did is we ended up working towards a combination of using the direct-to-consumer, the B2C aspect of acquiring users to get onto the platform. And we use that as a user evaluation part of the experience. So it's part of the trialing experience that funnels people into qualifying them for insurance. And so we now have the ability to support individuals, like I said, in 48 states on Medicare, Medicaid, and private insurance. And understanding that that's where the sustainability is today, is that a lot of folks that have disabilities are limited in disposable income, and they're extremely stretched. And so the reliance on insurance was something that we underestimated, but we embraced, and we figured out how to make the two work together. So traction-wise, the direct-to-consumer, you can get a lot of people onto your platform, but it's also very difficult to monetize through subscriptions to create a sustainable business model by itself today.
Yeah, interesting. Okay, we're going to move into some of the real world impacts, some of the stories behind these technologies, and then we have a small section about the future, just to give people a heads up on where we're headed. So Andreas, I'm going to keep it on you. You know, how did you get speech therapists to reconsider traditional methods and embrace your technology? What's the greatest impact you've seen with them? And then you touched on, you know, patients have commented that this is a part of their body. You know, if you have a great patient real world impact story to tell.
Sure. Yeah. Like I said, the challenge is today speech therapists, well, they're essentially the ones that are called in to do the evaluation with a patient to evaluate their ability to communicate using their voice, or if they need an electronic or a digital supplement for that. So they're like, if you're selling toothbrushes, you want the dentist to be involved with, you know, endorsing your toothbrush. Well, the same holds true for us. It's very important for us to have a good relationship with speech therapists around the world. But the irony is, in the evaluation process, it includes more than just a speech therapist, right? It includes making your technology available for the end user, the parent, or the fiduciary of that individual. And when you have to support multiple cohort sort of constituents within the evaluation process, it means that you need to redesign your business model so that it's really designed of service, right? So it's a servant leadership role. So what we've been doing is growing our relationships with speech therapists around the country, primarily through providing really in-depth training and support. We have built some learning programs within Cognixion that speech therapists can contact us and enroll for an online demo, and then we can certify them in the technology so that they feel empowered with the supports of our company to go out and do evaluations, and know that if they have a question while they're doing an evaluation, we can support them through video conferencing and online. So there's a strong SLP is the acronym for speech therapists. So there's a strong SLP focus for support. But what's interesting is, due to the COVID work, and it's forced a lot of speech therapists to rethink how they provide therapy, and the whole online therapy movement is really, really important right now because they can't sit down face to face with individual patients. So having our software be available for individuals that are dealing with, say, remote therapy or teleevaluations or teletherapy has actually helped us in a big way. So as an example, we've got a number of individual user stories ranging from children to seniors. So one story which is quite compelling is there's an individual that is one of our beta testers, and he's in Canada. If anyone wants to write about this story, I'm happy to disclose his name outside of this call. But he was a professor of Old English literature, spoke 9 languages fluently, and had a double brainstem stroke. It rendered him fully paralyzed. He was able to rehabilitate one arm, and he could tap out his thoughts with a knuckle on an iPad. It was extremely painstaking for him to compose his thoughts and took forever to do. But once he was able to do that, we were able to import his stored phrases into our system. And for the first time ever, he was able to do a 45-minute lecture in front of a class seamlessly and be able to respond to Q&A. So if you think about Stephen Hawking and the impact that Stephen Hawking had made on the world, and through his intellect, he was able to contribute to science. But had he not had technology, he would have been really sort of isolated, and nobody would have benefited from his ideas. So we sort of see the world of, there's 100 million more Stephen Hawkings out there, and it's our job to go find them and get them enabled with our technology so that their voices can be heard.
Yeah, that's amazing. Very cool. Justin, can you provide us with an example of what a patient may have experienced working through an injury, prior to you, and, how does it change, and your stories of impact?
Yeah, so I'll start with kind of the story of impact. So one athlete we worked with, he was a professional football player. He was retired at the time. He's 3 years out of the league. And he was complaining about an ankle, his ankle being, hurting whenever he was doing squats. And so, we ran him through we ran through our movement assessment, took a matter of minutes, and we immediately outputted, like he had an asymmetry. He was, overcompensating on one side compared to the other. And that's something that he never worked on with a physical therapist before. And this is 3 years out of retirement. So he was really blown away by that. We were immediately, in real time able to pick up the discrepancy that was occurring. So he was able to kind of make that adjustment. And to my knowledge, he went through PT, and I saw pictures of him working out just fine. He's doing squats the other day. So I feel like he's doing well. And so prior to us, in the PT space or, sports world, like you would come in, you would have to run through a assessment that was based off of the clinical eye. So the clinician or coach would look at you, see you perform movement, and just off of his experience, he'd be like, okay, there's an issue there. It looks like you're leaning one way to the left. Maybe your squat got way less, or they look at data over a matter of days to be like, oh, okay, there was an issue there, and they would make an average, and they would make an assumption of what they need to work on that next week when they're in rehab or, in their next training session. Where we come in is, rather than spending all that time relying on this subjectivity, an athlete, coach, patient, anyone's able to perform this assessment, do a squat, various other ones, and you can immediately pick out where the issues are. So, taking away that subjectivity that came with, I'm sure that he was 100% correct, and, he could see, and but you can't use your eyesight as a way to get insurance reimbursement. You can write down notes all day where the issues are, but to really lock down a full 10-week program with rehab, you're going to need a lot of objective data, and that's where we kind of come in, and then just creating that assessment process and cutting down the time, by close, can be up to like 55 minutes. So pretty remarkable stuff, and they can focus for the first time on treatment rather than evals and assessment.
Really interesting. And John, now let's talk about skin cancer and checking your skin. Can you share some of the most impactful stories you've seen from your technology? I know you have tons of users who write in about the technology, saving their lives. So.
Yes, I would be delighted to share a little bit about it. But I think this is where it also becomes quite personal for me, because I started the company because I needed a system with monitoring my partner, Ricky. She's blonde, blue eyes, had a lot of moles, and clearly in the high-risk group of developing skin cancer. So that was kind of like the story behind the company. Today, we have so many people writing to us and literally thanking us for saving their lives, since our technology helped them with documenting and identifying a change in a new mole on their skin. We have a woman, for example, Carleen from Colorado. She found a new mole on her ear. And when she showed this to her doctor, he immediately removed that because he can see the progress and he can see the documentation that is what has happened on her skin. Another person that recently reached out to us was Chris from LA, that discovered like 2 suspicious spots with the Miiskin app and later was removed by his doctor again. Now this doctor recommends this app to all his patients. So for us, this is a two-sided effect we get of this, but it's so critical. And for me, having that been through that personal journey, this is everything for me, and shows the important and impact this type of what I call smart technologies, all these advanced technology can have on people's everyday life. And this is very promising for the future. And I could say, look around us in this virtual space, and I can ask how many in this room has actually looked at their back recently, even though most people know that it could save your life to keep an eye on it. But you don't do that very often because it's not very simple.
Very cool. Okay, so we are going to dig into the future as you started to tease, and we have a couple of questions about that and about adoption. So Andreas, what are the biggest challenges facing AI in healthcare, in your space in general? What predictions can you make overall?
Yeah, I think, so there are 2 schools of thought. One of them, one of those working on AI to make it smarter. So there's folks that are working on AI to make a better AI. And then the other side are people like on this call that are utilizing AI and applying it for really important problems. And so I think one of the biggest challenges around AI, for better or worse, is AI itself. The perception of AI in some industries is really breakthrough, and in other areas it creates a lot of fear and anxiety around whether it's going to displace my job or is it going to start thinking for me, So I think there's this kind of human system fear factor duality that needs to be addressed from a PR perspective or from a narrative, like telling more stories like this that we're doing here, which is on the applied side. So I think that's really important. And so the future will really be about harmony between technology and the human. These examples, and especially in healthcare, you see lots of really great examples emerging around how technology is helping doctors make smarter choices. And so the technology just becomes a part of their toolkit for just becoming a better professional, or in individual life, that AI becomes something that you use to reduce the amount of time on certain processes. So in essence, we're all, this is kind of a how do you say, a little bit of a bold statement, but we're all kind of cyborgs in the sense that we're all augmented through AI, and in some instances we just don't know it yet, right? So the fact that we're using smartphones to enhance our access to knowledge through the internet, and it's way faster to get to information than ever before, we're enhanced, right? We're already using AI in a big way. So I think, again, the future will really be around how do we manage the perceptions of AI, which gets into ethics. So how do we deal with the ethical use of AI and creating boundaries around what AI can and can't do, or how it should serve the human as opposed to replace certain tasks. So there's some ethical things that have to be dealt with. And then also from our perspective, I didn't really share much in my preamble about the work we're doing beyond Speak Pros, but we're also, we have a research team, an R&D team at Cognixion that's based in Toronto. And we're doing research in brain-machine interface and augmented reality experiences. And we're applying that knowledge into our day-to-day applications. But when it comes to, say, things like biometrics, where AI and machine learning can play a really important role, you're going to start to see neurotechnologies like brain-computer interfaces starting to become more prevalent in real everyday use cases because of machine learning and AI. The historical thing about AI is that it's based on statistical models. And now that you can build neural networks, not just in the cloud, but for us to be able to build, say, a brain-computer interface, it has to perform offline. It has to work in a small little microprocessor that you can wear with no dependencies on the internet. So that's a really big engineering problem. That's very difficult to solve. And so I think there's a lot of really hard, they call it hard tech, and deep tech kinds of problems that are going to need to be solved over the next decade. And they're being worked on today. And so I really am excited about what the world is going to look like in 10 years, because a lot of these harder problems around physics and power management, microprocessing of big data on small microprocessors, a lot of that stuff's starting to happen and it's breaking through. And then you're going to see all kinds of interesting innovations that are going to be, you know, class 2, class 3 medical devices, implantable devices, wearable devices that are going to be coming online because of AI.
John, let's talk about, you know, computer vision, machine learning, AR, the areas that you touch in skin health overall, you know, what's coming. Are there any predictions and things that you're excited about?
I think there's a lot of things that I'm excited about. So I think, of course, in the future, the advanced technology such as machine learning, computer vision, and combining all these elements will, end of the day, assess skin and skin lesions and become decision support tools for clinicians. And I especially emphasize the word on the clinician because it is a decision support tool in the beginning. So at the same time, I think out in like consumer space, I think the technology will be able to detect and alarm if anything unusual or alarming has appeared on your skin, but basically as a support tool to your own personal process. And I think, of course, sometime in the future, but I think it's probably a few years ahead of us. I believe that these two kind of clinical and patient consumer approach, they will emerge into a system that can kind of take advantage of both these processes. But I think it's very important to make the notion and differentiate between these two like sides of the challenge. For our own sake, I can say I think where we're focused in the near future, we are developing some advanced mold sizing system that again combine the latest computer vision machine learning to a system that can automatically measure the absolute size of your moles on your skin. And science tells us that moles over 6 millimeters need some extra attention. And with absolute mole size, you also be able to see and get a more, I would say, objective approach to growth of moles on your skin. So on the long term and short term, I think we're doing a lot of progress here, but I think end of the day, you need to cater for the patient in this process and for the regulation and industry, of course.
Very cool. And you had a question from Sarah with Moby Health News. She said, what way do you foresee the technology in the area of skin cancer recognition becoming more advanced? How do you hope it will evolve? So I think you touched on that, but if there's anything to add specifically to skin cancer recognition, I wanted to note that question for you from Sarah.
I know that advanced technology used on clinical images where you have dermatoscopy and added extra lighting and so forth, they're doing really good research and having some amazing results that can really support the doctor and the clinician in this decision process. So I know already today there's some amazing companies out in the world that already use this type of approach and help the decision makers, which is the doctors currently. So this is something we will see more of. I think from a consumer patient perspective, I would say that it's probably quite some years before we kind of can do this in that context, but it looks promising.
Very good. And Justin, let's get your thoughts on the future. What is coming from machine learning and 3D visualization and injury prevention overall, and any predictions about things that you're excited about?
Yeah, so our industry is really driven by hardware, and some of the biggest hardware players to see where they take tech, like the Apples and Microsoft, to see what they're doing with computer vision, new updates coming out, like AR Kit 4, which could really make a huge difference in full body motion capture, especially, having something that's on a phone for the everyday consumer, and bringing to light this idea of movement analysis. And right now, movement analysis isn't something that a consumer would ever think of. No one really knows the importance of that or what it means. But it's just like ergonomics, right? Ergonomics was, important. Then all of a sudden, it started to spread, and then it became huge. And if you look at Google Trends, body movement is now passing ergonomics in search results. So it's really exciting to see. And using AI and machine learning, where we're headed is this idea of predictive analytics and starting to make assumptions on the way that people move and what risks are associated with those movements, and what that could lead to as another tool in the clinician's box, as you've been hearing before, and having that as a way to help with diagnosis and go right to treatment rather than worrying about eval, worrying about insurance reimbursement, but already having that done in real time, and then just worrying about treatment, making sure that the patient is leaving pain-free. So it's really exciting to kind of see how fast the industry is shifting and where the world's headed towards movement analysis. And once that trend of the consumer really starts to pick up, we're really hoping to leverage that. And that's where we plan to use augmented reality and different other ideas that in computer vision AI to really hit that trend well. So yeah.
Awesome. Okay, I want to encourage our attendees. This is the Q&A portion we're going to move into. So for those of you that jumped on late, there is a Q&A button at the bottom of your screen. This is how you are submitting questions to me and how those have submitted that have already come through. I have a question from Health Leaders. Mandy, the reporter there, would like each of you, I'll start with John, to know what the advantages of your specific product or service provide to the hospital and the health systems specifically. So obviously the healthcare world has a lot of different components in that business. So when we're talking about hospitals and clinics, what does working with them look like for your technology?
Yeah, thank you very much. Currently, I think that this is really interesting, and this is especially during this pandemic. Telehealth is on everybody's mind now for good reasons, and of course, by enabling a closer contact with clinicians and patients, engaging them in their own healthcare, we get the opportunity to actually, I would say, strengthen and amplify that process and engagement in between these two stakeholders. Because at the end of the day, telehealth has also showed us that not everything can be done with video consultations. In dermatology, for example, high definition images of close-ups is extremely important to doctors in this process. So for us, that's kind of like next step, working more integrated with these hospitals and clinics, and that is something we are already in process with, I would say, because we have got quite a lot of traction here, especially over the last 3 months, I would say.
Excellent. Andreas, do you want to take the lead next?
Sure, thank you. What's interesting is so the inspiration for our company started in the ICU. Our company, the idea around nonverbal communication access started when my mom was admitted into the ICU with pneumonia. It went into septic shock and kidney failure. She did survive, but it was a tremendous ordeal, weeks in the ICU and the whole continuum of discharge and so on. And the irony is what we're going through today with coronavirus resembles my personal experience with her in the acute care, where you have very traumatic experiences for individuals. In the last few years, though, we're focused on post-acute care, private practice, rehab, because it was much more around setting people up for long-term needs and access to our technology for day-to-day use, active daily living. But because of coronavirus and COVID, it sort of reopened that opportunity for us to enter into acute care. So specifically to introduce our iPad with trauma-specific language within the application that you can access hands-free with your eyes and face, right? So being able to set up a stand with an iPad next to a bed in an ICU for a patient that has a respiratory care or a ventilator, so that if a doctor comes in or a nurse is making their rounds, they can ask questions and that patient can respond with much less effort, and they can explicitly answer yes/no questions, or if you're having pain scale stuff, they can explicitly tell you what the pain level is. If they want you to, contact their next of kin, or they want to, tell you where their advanced directives are located. Any of these kinds of things can now be configured within our application, and then they could introduce essentially a protocol within acute care so that they can deal with sanitation and personalizing the experience for different patients. So we're in the process right now of doing an IRB study with Cottage Health Systems in Santa Barbara on that specific topic.
Very interesting. And Justin, how about we get your take on that?
Yeah, so from our perspective, it's one, in a hospital setting in PT world, you'd be seeing so many patients in an hour, upwards of 3, maybe even 4 patients in 1 hour. So you don't have a lot of time to interact with them, and that's where you lose a lot of patient buy-in. And that's, where you kind of lose patience. And where we come in is providing a tool that can improve that quality of care and that experience for that brief amount of time that you have, and as well as the communication understanding of where they're at, where they're headed in their treatment, and building a better relationship with the physician. And then on top of that, increasing the communication from an outpatient facility to someone, if pre-post surgery, having a better tool that can that's spread across from the hospital to the outpatient facility, and something that is the same data, reliable, so the orthopedic surgeon, whoever did the surgery, knows where they're at in their rehab program from an outside facility. And that's really important. And that right there in itself could save thousands and improve care just in at least one in 5 people, no problem. So and that's really exciting. That's something that, one of the biggest drivers for us headed into the medical world.
Very cool. Okay, we have one more question for each of you that's come in from, his name is Kurt. I believe he is with Forbes, contributor. We started to touch briefly on this. So augmented reality has struggled in the last couple of years to gain traction, especially in the consumer space. What issues are you finding with AR, and why do you think adoption has been problematic? So I'll throw that to you first, John.
I'm guessing that I think maybe the technology has been a little bit immature, I would say. And I think it's also augmentation of the real world has also been, I think, mentally also difficult to cope with for reasons. So I think it is a complex space, and these two things need to mature slowly together. In the beginning, you could only run these on very expensive big gadgets, so to speak. It was not really a part of the consumer space. Then the gaming industry started to use it with success and so forth. And I really see more, I would say more, at least other industries now starting to adapt and using this, because it is engaging, it is very visual, it's something that you can augment reality both with audio but also visually. So I think we will slowly see the industry changing now, but I don't think that the AR in itself is the game changer. I think it's what makes it more engaging, more live, and more understandable to the person using it. So the underlying value of the feature or the skill set you need to do. It has to be there, but you can make it a lot more convenient and approachable for the user using AR. That's at least how I see this.
Andreas.
Hi, Kurt. Great question, and I appreciate your sort of technical background and interest in that. I think for some of the non-technical folks on the call, I think AR is kind of a blanket statement, or VR. So it's, you know, just for clarity, so VR is really the closed environment where you have a shoebox on your face. You know, AR is where you have a clear lens, so you can sort of see holographic things overlaid over reality. So it's kind of truly augmenting what you're seeing. And then if you think about augmented reality, there's sort of two forms right now that you can kind of generally say. There's the mobile AR, right? So where you're using the camera and you're doing some graphics overlay over the reality, but you're holding a device, kind of doing an AR example like this. And then there's the like Microsoft HoloLens, like the big AR headset version where you're hands-free AR. And so, you know, Pokemon Go, I think, set the world afire with regards to mobile AR and got a lot of people excited about it. But then there really wasn't sort of a sequel to that. There wasn't a bunch of other developers coming in behind it. So there was sort of this vacuum effect where it was sort of a flashy thing once and done, and there really wasn't anything else sort of queued up to follow suit. And so I think it's really about content and applications and having just more of it available on a mobile perspective. I think John's right regarding the adoption for headset-based AR or VR. They're expensive. They require a wired connection to a PC. It oftentimes is required to have a Wi-Fi connection to the internet. So and then you need to have content and game developers. So I think really what you're getting at is an inflated expectation where it wasn't really fulfilled. Like the promise of AR hasn't been fulfilled because a number of these dependencies haven't been removed, like wired connections to PCs, the ability to have everything kind of self-contained with long battery life, and content. So we believe, and I think everybody on this call believes, that really AR will come into its renaissance when you have killer applications, right? Applications that really work, they're flawless, and they're effective, and they solve a problem that people want solved, and they're willing to pay for it. And I think that's what we're doing. Is we've identified, between the three of us, we've identified big global problems that AR is a really great fit for, and we're applying technology to solve a problem rather than, you know, building technology chasing problems, right?
Sure. Justin, do you have anything you'd like to add to that?
Yeah, so really great question. So my background is actually in human-computer interaction and virtual reality. That's how I started out in my career in the computer science world, and how I ended up here. So you know, one thing that you know, there's a perception of, at least from my experience, it's really AR is really used for gaming, and it's really only to kind of echo what some of you guys were saying. There's a perception around it of like, you know, you just play video games. They don't understand the immersion side of it, all the other aspects that come from it, but they don't really need to at the same time. But that relies on the entrepreneurs like us to create problems that can solve that solution through the use of AR, virtual reality. And I think that people, you know, at least now, like the millennial generation is you know, coming up. They're the ones starting to run the show, but the, you know, boomers before that, they were really focused. They never adopted virtual reality, and I've seen people use it. And you know, I've seen people they put a virtual reality headset on, they get weak in the knees and fall because their brain's not used to that. And it's really quite interesting to see how people interact with that. So I think you're going to start seeing it pop up a lot more with this next generation come through and really start leading the way. But it's going to be reliant on entrepreneurs to find use cases, because right now there's a perception that this is only used for video games and Snapchat and mobile phone apps that are fun to play and take up way too much time. So I think that's going to be a huge shift in the industry, and I'd say within the next couple of years.
Fantastic. All right, guys. Well, that is a wrap. That's all of our questions. We're just a few minutes over, but I hope everybody enjoyed the panel today. A lot of useful information. I know I learned a lot, so I appreciate everybody who hopped on to hear from us and the panelists who took their time today. Thank you so much, everyone.
Awesome.
Thank you.
Thanks for having us.
All right, everyone have a great rest of their day and their week.
Thank
Thank
you.
you.
Bye.
Thank you.
All right.
Take care.